Welcome to The Beat, your go-to where leaders, founders, and investors share insights on growth, innovation, and business building. I'm Chitra Nabat, your host. Joining us today is Ezra Mehlman, Health Enterprise Partners co-managing partner. Ezra, welcome. Thank you for joining us.
Thank you for having me. I appreciate it.
Tell us about your firm and what's unique and differentiated about your investing approach.
Sure. So we are a healthcare IT and healthcare services focused growth equity firm. Among the distinguishing characteristics of our group is that about 2/3 of our capital comes from hospital systems and healthcare insurance companies. So we have 21 hospital systems, 19 payers. We work with this strategic network to identify companies that are responsive to their up and net issues and pain points, and our LPs can serve as a source of commercial acceleration, diligence, pressure testing new product ideas.
How do you compete to attract the best founders?
Well, in today's market and over the last 10 years, there's been such a buildup of venture capital dollars within healthcare that we have to stand on the basis of track record and also the strategic benefits that our network confers. And so we're very diligent about tracking the introductions and the connections that we can make between our network and the portfolio companies that we invest in, which introductions materialize in commercial value, what the total contract value is of that, and then furnishing that data back to the founders who might be collecting term sheets from 4 or 5 other funds.
You mentioned venture capital dollars building up. Let's get into the investing landscape.
Let's do it.
Last year saw the lowest amount of capital invested in U.S. digital health startups in 4 years. VC funding and deal volume sunk more than 60%. VCs, including the big brand funds, have written down big portions of their portfolios. And roughly 130 health tech unicorns had their valuations plummet more than 50% over the past couple of years. What's been the experience at your firm?
It's a great question. So I might just walk you through how we see the market and what the implications are for healthcare IT investing in general. So beginning with your unicorn deflation point. We think that since 2013, if you look at the 200 unicorns, so privately held companies that have achieved a valuation of over $1 billion, so 53 of those have exited, so 53 of those 200, 43 of the ones that exited either IPO'd or SPAC'd. Of those IPOs, of those that went public, I think that 70% of them are trading at less than half their IPO price, and 40% are trading at less than 20% their IPO price. So that leaves 140 companies or so left. Of those 140 unicorns, about 70 have already been marked to market and are no longer a unicorn. And that leaves a bucket of about 70 companies that may still hold this status. But if you just kind of press rewind and you think about of the 200 companies that are kind of in the top of the funnel, the percentage of total healthcare venture capital dollars that those 200 unicorns captured is immense. I don't have the number, but it could be 30 to 40%. You think about this value contraction event that occurred, and so we believe that we are in the midst of a tremendous kind of thinning of the herd of the supply-demand imbalance in healthcare venture capital may just be finally getting corrected. A lot of the capital that is in those hyper-capitalized businesses is contracting. So to answer your question, what does that imply for a fund like ours, placing investments? I think we see a couple things. One is that profitability is clearly being rewarded, among healthcare companies, and so that sort of contraction in the private markets, really followed a contraction in the public markets, where the market cap of public healthcare IT companies went down by 90%. But if you unpack the ones that are profitable, there's like a 300% premium on the revenue multiples of those companies. And so championing principles of profitability, both across our current portfolio and then identifying profitable new companies to invest in, that has been really, really key. I would say among the portfolio that we have right now, finding a way to get to self-sustaining basis on available resources has been important, because there is no certainty to that next sort of externally priced round. And then I think the last thing that I would mention, and I know there's other questions on this topic, would be there is with this rationalization of the market, there's been a fading away of the sort of nice to have, particularly in the software space. And so really trying to survey industry leaders of what are those pain points that need to get funded now, what are the necessary technologies and services, because the market for sort of discretionary 7-figure TCV software solutions is kind of evaporated.
But on those 2 points about the evaporation in the market and on your earlier point about thinning of the herd,
yeah,
right?
Yeah.
Where is capital being deployed? Because analysts say private equity firms have roughly $650 billion on the sidelines, waiting. So where's your firm investing?
Yeah, sure. So we have just to double click on that, we have 2 categories of investments at HEP. So we have our growth equity bucket, and those are typically businesses within the healthcare IT, tech-enabled space, usually between $5 and $20 million of ARR, usually growing north of 50% year over year. We're typically investing $10 to $20 million in the balance sheet of those. We also have healthcare services businesses, and those are usually like single-digit EBITDA, meat and potatoes, healthcare services companies that are profitable. And because we have sort of these 2 sides of the portfolio, based on where the market is, we're able to sort of like lean into one strategy, over the other. Right now, the sort of more stable healthcare services companies tend to be garnering more interest for us, largely because the value contraction among those has been more muted. In the healthcare IT space, you had revenue multiples go, public ones from like 11 times calendar year plus 1 revenue to like 1 times calendar year plus 1 revenue. In the healthcare services space, it's gone from sort of high teens EBITDA to like low teens EBITDA. And just a couple themes that we're investing in: outsourced non-core services for hospitals. So it's become very financially difficult to operate a hospital now, as has been discussed at length in this conference. Thinking through what are the bucket of services that a hospital used to provide, whether it's biomedical engineering or call center, that it no longer makes sense for them to provide economically, and how can you partner with them? Administrative automation, how can you think about leveraging a bit of technology to sort of automate some of these non-sexy, back office areas, things like that.
So, outsourcing non-core, automating administrative tasks.
Yeah.
These are all themes that have existed for some time. We're inundated by so many companies saying that they do that. We're inundated by a lot of shiny objects in health tech. Over the next 5 years, where is there real money to be made?
So I would say, I would answer it in 2 ways. One is from a capitalization standpoint. So where are the exits, I think, is part of your question here. So I think that if you accept the premise that the venture capital model of companies raising successively higher priced rounds and $100 million plus is sort of in a state of shock. That's sort of all getting worked out. If you accept that premise, if you also accept the premise to a point you made before that there's $600 billion of dry powder in the private equity space, and maybe $300 billion of cash on the balance sheets of the strategics. If you accept that premise, along with the fact that the IPO window is closed, you do have the makings of sort of a torrent of M&A about to be unleashed, especially as buyer and seller price expectations come down. So then the question is, what are the companies that will get acquired in that setting? And I think that the companies that will get acquired are the ones who have resisted the temptation to raise too much money and therefore can sell to a strategic or one of those private equity firms without being held hostage to unrealistic investor demands. And just to be more specific on that, if you unpack where the M&A is occurring in healthcare IT right now, about 90% of it last year occurred below $250 million of total enterprise value. So if you can underwrite an exit and partner with the management team that is willing to define success along those dimensions, there should be a lot of M&A to be done in healthcare.
Leadership.
Yeah.
In life and business, there are rules, codes, norms to how things are done. Where have you been a code breaker, and how did you do it?
Okay, that's a great question. So I come from a family of academics, and my parents and sister are all humanities professors, and I was, going to sort of devote my, self to the family business, and become a history professor. That was sort of the plan, and the advice that they gave me was really counter to the advice that I think a lot of young people in like the venture capital and private equity space get. I think the conventional wisdom is to become the best generalist you can, and keep as many doors open as you can. The advice that my family that were academics provided me was, as early as you can, become a specialist in something as specific as possible, so you can differentiate yourself on behalf of being an expert in something. While I didn't enter the sort of academic trade, I did carry that sort of research-driven focus of early sort of declaring a major in healthcare, and it was something that was easy to actually declare a major in, because as we all know, it is so vast and so intellectually rewarding to tackle sort of a new topic. So hyper-specialization early in one's career, I would say, is a bit of a code-breaking concept for a lot of people.
Ezra, thank you so much for joining us.
Thank you. I really appreciate it.